So the question says, what is the ideal period of contraception to be advised after treatment with isotretinoin to avoid any teratogenic effects of the drug on the fetus? So if you are thinking that the answer is 3 months, then your answer is absolutely right. But I know few of the students are thinking about that the answer is 3 weeks, which was wrongly given as a correct answer in one of the coaching institutes. But please remember, this is a wrong answer, which is by mistake given as a right answer in that particular institute. And also please remember, isotretinoin is used in the case of acne vulgaris, that too specifically grade 4 acne, also called as nodulocystic type of acne. Okay, and the question itself mentioned that it has teratogenic effects, that is, it is category X drug. So but from your pharmacology knowledge, I hope you all know that category X drugs are strictly avoided during pregnancy. So for example, you become a dermatologist in the future and you want to prescribe isotretinoin, so always you should advise that even after stopping the isotretinoin drug, the patient should use some form of contraception at least for a period of 1 month. So since 1 month option is not there in these options, so I just want to show you one reference. This is taken from Fitzpatrick's textbook of dermatology, where it is given that must practice effective contraception during the treatment and for 1 month. 1 month is there, and otherwise 2 months also is the term which is followed in few of the countries. But please remember, the other options are mentioning 3 days, which is absolutely wrong answer, and 3 weeks is also wrong. Why? Because the minimum period of contraception should be for at least 1 month, that is 4 weeks. Okay, and few countries it is 2 months, and in few places it is also mentioned as 3 months also. And in US there is a program with the name I-Pledge, that is isotretinoin pledge, which is followed very strictly in few of the countries. And this is taken from Wolverton, which is the Bible for pharmacology in dermatology. Okay, so here also you can see that this is isotretinoin under the I-Pledge program. It should be, the contraception should continue for a period of 1 month after discontinuation of the therapy. And one more point I want, a bonus point I want to tell you is that the abstinence or contraception should commence 1 month before starting the therapy with isotretinoin. This is also very important future MCQ which can be expected. And one more additional point which I want to get to the notice of you is this Acitretin, which is the drug of choice which is used in pustular psoriasis. Here in Acitretin, the period of contraception is completely different. The contraception should continue for a period of a whopping 3 years following the discontinuation of the Acitretin. So these two numbers are important. For isotretinoin, please remember the range is 1 month to a period of 3 months. And for Acitretin, it is 3 years. So this is from Rook's. A few important points is 1 month isotretinoin and also ALITRETINOIN and BEXAROTENE. So these drugs, for these drugs also the period of contraception is 1 month, whereas in Rook's it is mentioned 2 years for Acitretin. But please remember, better to remember a range of 2 to 3 years. If both are there in the options, better go with the answer as 3 years. So do subscribe to my YouTube